our supplement is not an addition to the hormones. It's enzyme regulators that will increase and decrease the precise hormones that we want.
Dr. Ray Nettles is redefining hair and hormone health with data-driven precision, transforming patients through custom biochemical insights. Get ready for a conversation about real results and lasting health.
In terms of how he feels, is there a difference resulting from that too?
The patient received more hair growing. He lost about 20 pounds. The patients would always say, I had a little sugar in my coffee.
Seems like everybody should get one of these, right?
That's exactly right. Almost everybody should get a customized supplement. We're ready for the BRC review call.
Yes, perfect. We have a great one today, actually. One of your recent patients. So it'd be good to have a look. That came in recently. It'd be good to have a look at, see what happened before he started the program and then what happened afterwards. He's been on the program.
Okay, Tracy, it sounds like we're going to be reviewing one of our patients' BRCs from before the process of starting with Stop and Regrow, and then after taking the oral supplements. So we're going to be seeing a patient. He's about mid-60s, and the patient came in with symptoms such as hair loss, hair thinning, gaining weight, losing muscle, losing energy, and we ran the blood work, and we got the results. After interpreting the blood work, we then started him on his customized supplement, and we have the blood work afterward, and we can analyze those results today.
Yes, that is correct. So if you're ready, I can pull the BRC up on the screen for you.
Okay, so Tracy just said the word BRC. That stands for Biochemical Report Card. And this is a reflection of the analysis of the biomolecules inside your blood. So we send you to the lab and they draw the blood, and then they will send out different blood samples to multiple labs to have the analytics done. And then once they measured all of the molecules inside the bloodstream, they send the results back to our office. And then we compile it into a one sheet called the Biochemical Report Card, where we can best analyze the 9 biomarkers that are indicative of the health of the hair follicle, as well as the body itself, the skin cells, the muscle cells. So what we're looking at is on top, you'll see the nutrition, and those are the molecules involved in our daily nutrition. And then beneath that, we'll see the hormone axis, which is determined by our genetics or our DNA. So once again, this patient is mid-60s and came to see us, and he had the blood work done. He had gained a little weight, lost a little muscle, had no energy. And you'll see here that the food is made of one of 3 molecules. The calories come from one of 3 molecules. And you'll see that protein, fat, and sugar. And today we can measure a 90-day average of your sugar intake. So years ago, Tracy, the patients would come see the doctor. They would have a high sugar number, and it was a 1-day sugar. And the patients would almost always say, I had a little sugar in my coffee, and that's probably what caused it. So today we now have a 90-day average of the sugar intake for the last 90 days. And that the biomarker is called hemoglobin A1C. And the reference range for diabetes starts around 5.7. So this patient came in at 7.1, already in the diabetic ranges. We conducted a review of all the things that he was eating, and then the things that contribute to the sugar, because sugars are made from carbohydrates, and carbohydrates can be hidden in things like fruits and vegetables, as well as bread, cakes, and candies. So we have to figure out where the sugar is coming from and then decrease it. So after, it looks like the patient came in 6/14/24, a year later. So within a year, the A1C had come down dramatically, down to 6.0. Now our goal is under 5.0. This is where the athletes are. So we're going to keep working with this patient and hopefully hit the number of 5.0. Now that's going to help him long term with his weight gain. He actually lost, I think, 20 pounds over the course of the year. So this will help with weight loss, weight gain, as well as the molecules in your brain that keep us feeling good, not anxious, not depressed, as well as our vessels, our cardiovascular system, our arteries, our heart. People have strokes and heart attacks a lot of times because the sugar gets too high. And think of sugar as what sugar is. Sugar's sticky. So think of molecules inside your bloodstream sticking together. What could be inside your bloodstream that you wouldn't want too much of? The fats. So imagine sticky fats causing clots that end up causing strokes and heart attacks. And the thing that people look for is triglycerides, and a triglyceride is several fats attached to a sugar molecule. Okay. So within a course of a year, the patient's sugar went down based on our recommendations and our follow-up. Protein, hair is made of 88% protein. So today we can measure the amount of protein from your diet that gets into your bloodstream, which is amazing. So this patient came in at 6.6. So all of his hairs were thinner than they could be because our goal is over 7.5. Okay. So after the course of a year, the patient increased a little bit to 6.7. Okay. Now, part of the reason why it didn't go up dramatically is that his hair is starting to grow. And if hair that grows is made of protein that comes out of your bloodstream, more of it is being used to make the hairs. Does that make sense? So even though he increases protein, we need to increase it even more to continue to feed the hair follicle. Okay. The other component of calories that come from food that give us energy is the fat calories. They can come from good fats and bad fats. So we follow the good fats, or the HDL, and the bad fat, or the LDL. So this patient was asked to increase the olive oil consumption, tuna fish, avocados, and nuts, and it increased a little, 43 to 45. Our goal is over 60. So we need to keep working on this one. But you start to see the way that nutrition impacts your health and the way that we can measure and monitor the molecules that contribute to your nutritional health over time. And we have patients that have been with us for 18 years. So we have 18 different samples or trends of the biomarkers from their nutrition. Okay, great. So the next component would be genetics, which really is our hormone axis, which is dependent upon our DNA molecule and the genes that we have. So this patient, as we said, mid-60s. As we know, the testosterone levels as we get older decline quite a bit drastically after the age of about 45. So this patient is mid-60s, so he's on the low end of the scale. His total testosterone was 217. So we created a supplement based on what we see in his hormone axis. So he had low testosterone that we needed to go up. He had low free testosterone. Just like the LDL and HDL fat, there's a good molecule of testosterone, and then there's a bad molecule of testosterone. So the good testosterone is the free testosterone. He came in at 2.6, and this is low. The scale, you want to be over 12, and then the total testosterone over 600. So both of these molecules, we would like to go up with the patient. And then we have to find a molecule that is too high that can come down, because we're going to be using the first law of thermodynamics. Our supplement is not an addition to the hormones. It's enzyme regulators that will increase and decrease the precise hormones that we want, so that we can change and calculate a signal from the molecules in the bloodstream to the DNA in the hair cell and the skin cell and the muscle cell to improve. So that would be nicer skin, leaner muscle, less body fat, and then hair growth. And all of that happens from the supplement that we customize. Which molecule is too high? So the DHT molecule should be between 3 and 10, and he's at 14. So we need to decrease this molecule to be able to increase the other molecules. Now, men have testosterone and women have estrogen. Men also have a little estrogen, and women also have a little testosterone. So it's all about the balance. So the estrogen in a man's body is safest when it's between 18 and 32. So the patient came in with a 28 estrogen, which is in between the ranges. However, with all the other numbers being so low, we were thinking it was possible for his estrogen to increase, and it did, as we see here, but still 32.9 is within the reference range of 18 to 32, okay? So the last thing that we look at for a male is the PSA, the prostatic specific antigen, and then on the program, the PSA will decrease, which is healthier in a man's body, because the prostate the DHT is impacting the health of the prostate and is causing it to grow faster than it should. So our goal is to decrease our PSA by decreasing our DHT, okay? So after we customize the supplement, the after results are in this column here, and our goal was to increase total testosterone, which we did by 50%. Okay. We then wanted to increase the free testosterone, which we did by 50% again. We wanted to decrease the DHT, and our goal was between 3 and 10, and we got a 1.5. So the goal truly for the DHT is based on the ratio of the free T to the DHT. So in most people, we're shooting for these absolute numbers on the right. When we have someone that has very low levels, we look at the ratio. So the free T, when the patient came in with hair loss, you see the free T number was lower than the DHT number by about a factor of 6, right? After the supplement use, we regulated the enzyme. We now have 2 times more good testosterone to the bad testosterone. And that ratio creates a positive hair growth signal, whereas the other ratio caused a negative hair growth signal, okay? So not only did we get an increase of total T, increase of free T, decrease of the bad T, we got normalization of the estrogen level, and then the PSA prostate went down by another, 50, 60%. So the prostate is healthier as well. All of this happened because of the supplement that we had to regulate the enzymes inside his body. So between nutrition, which has improved, and the genetics, which have improved, we would expect to see hair regrowth, which we did in this case.
Great. And so then in terms of how he feels, is there a difference resulting from that too? That extra testosterone looks like it should.
Absolutely, Tracy. So not only did the patient receive more hair growing, he lost about 20 pounds, as we talked about earlier, and then his muscle tone improved and his energy levels improved. His capacity to chase his wife around the room improved. So everything improved in his life because of the supplement repairing genetic defects, which were abnormally making the wrong amounts of hormones inside his body, causing signals to the cell to do opposite of what he wanted.
Got it. Makes sense. Okay, great. So it seems like everybody should get one of these, right?
That's exactly right, Tracy. So almost everybody should get a customized supplement based on their blood work. You're right. Now, 80% of men and 40% of women have a reason to come get the biochemical report card because they already have hair loss. But the other men and women that are suffering from decreased energy, weight gain, not enough muscle, lean muscle, attention deficit disorder, depression, anxiety, all of those things can be determined from the biochemical report card, and a customized supplement could bring back energy, decrease your anxiety, and improve your health. So on top of bringing back your hair. So I always tell people you come for hair, but you stay for health.
Yeah, that makes perfect sense. Thank you so much, Doctor.
All right, let's do another BRC review next week. And we can also do a pattern recognition, and we'll go over the 5 zones of hair loss, and we'll discuss the different patterns between the genetic hair thinning and recession as opposed to the autoimmune hair loss where the hair follicle is ejected from the scalp. And those patterns can be recognized with the pictures themselves. And a topical supplement can be created based on the pattern that we recognize.
Okay, sounds good. See you then.
All right. Thank you very much.